So there is a certain definition to CDM. It refers to management of data capture. So we are capturing the data, and then we have certain data flow process in the entire life cycle of CDM. So whenever we conduct clinical trial, whatever data that we capture from the uh, patient, now patient data is also known as source document. So patient data, from what all places you can get patient data, guys? Which all places?
Mainly in clinics and hospitals.
Clinics and hospital, which is also known as sites.
Sites, yes, ma'am.
Yes. What else? What else? What do you think? From where are we getting? So when you say sites, clinic and hospitals, where are they saving the patient data? Like if you go and ask for that, I need the data of this particular patient, what all documents they will give you?
Give us some forms to fill over that about the patient age details
Hmm.
and some about their uh, mainly they'll ask about right what are the symptoms you have
Okay.
and and it covers the mainly age. It matters the age and
Hmm.
duration of the symptoms.
Okay. So this is something that you are telling me, that whenever we go to a doctor and if you are facing some kind of health issue, they will ask you certain questions or they will ask you to fill up a form, and then you give the entire data of that particular situation, health condition, right? So in clinical research, the same kind of form that we are talking about over here, that form is known as case report form. Case report form. Case refers to patient. Case report form. Now whatever data, now in that form, it is not a single form in clinical research that we use. We have multiple forms, multiple data to capture from a single patient. So all that data would come from your lab reports, your ECG reports, your sonography reports, your whatever test is asked to be done. We have labs. We go to a lab, we give a blood sample, we have biochemistry testing, hematology testing, we have immunology testing, we have different, so many tests. All that data comes from lab. Along with that, you also have physical examination. Sometimes you have certain kind of measurements to take, just to check. Now if you would have heard about TB test, you know what do they do in that TB test? They will give you that particular injection, and they will tell you to come after 5 days, and then they will measure that particular area. Am I correct? Anyone who has gone through that TB test?
Yes, ma'am.
Right, you would have seen in your family also, or if any of your friends would have discussed. So same kind of thing, basically it is, you are doing a physical testing. You are measuring that particular area and checking if the length measures the this tuberculosis test, that means it is positive. If it is this much of length, then it is positive. If it is lesser, then there is no reaction. So depending on the study, there are a lot of different tests that is performed. Your blood pressure, height, weight, physical examination, your BMI is captured. So all that data goes into your case report form, and that data comes from your patient data. Patient data could be your lab reports, like I said. So those patient data is basically known as source documents in clinical trial. Source documents, source data. Now, why is it so important in CDM, in clinical data management, that we are collecting data, and why is it important to do, have a clinical data management team? So your CDM team helps to make sure that whatever data that we are collecting is